Okay.
Okay, good morning. We're here with another staff interview. I'm Pascal Ballard, and today we're interviewing Jo Ann Kalb. Yes. So, Joanne, what do you do here at JFCS?
Well, I'm a licensed clinical social worker. I work in the Client Older Adults department. I work primarily with seniors, 60 over, and family caregivers. Lead a couple support groups for grandparents raising grandchildren, and various sundry things. Do public presentation, education, um, for both caregivers or at senior centers, wherever.
Just kind of promoting us.
Yeah, promoting us and the services, and we're funded. A lot of our funding comes through KIPTA, which is the Aging Network. So we do partner with a lot of various other agencies to help be a point of focal point or a point of entry for seniors and their families, so they can access services in the community.
Okay, so can you tell us more about what we do with the seniors?
Okay. It really ranges on what their need is. From seniors that are wanting clinical services such as counseling, and seniors like all of us, no matter what age, have different crises or issues in their life that looking for professionals to come to talk about that, from depression to anxiety to some substance addiction to various things. Other seniors that we service, we provide services such as like telephone reassurance, seniors that are homebound, and it's a way for them to have somebody to check on them. We have coordinate volunteers to do that. Friendly visiting also for seniors that are homebound. We provide services for like the families. Oftentimes the seniors don't come to us, but their family members, because they're concerned about mom or dad or aunt or uncle, whoever their loved one is. And we kind of help them access resource and problem solve of, if there's a need to move to a higher level of care, they're no longer able to live out in the community, finding placement, to just helping them troubleshoot and to gain access to resources for their loved one.
So, you act as a general guide through this part of their life.
That mentor, sometimes confidant. I'd say that's a good word. A mentor, someone that can help them live the best, the fullest, wherever they are, whatever their level of ability or involvement in the community, because of either disease or health status, or even sometimes emotional state, depression or anxiety. Our whole philosophy is to empower the person, the individual, to be the best that they can be. And it's our privilege, and I feel this way, it's my privilege to help people live their life the way they want to do that. If it's if it's safe. Obviously we deal with some seniors that have cognitive issues. So if they're dependent or at risk for exploitation or abuse, or sometimes we run into that situation when we go to do home visits or assessments for seniors, and it's a very sad situation, then we kind of step in and go beyond that mentoring role to really an advocate to act on their behalf for the vulnerable senior citizens that we serve.
Okay. Well, my next question was, what do you like best about working for JFCS?
Well, I think what I like, I love my clients. So
I was gonna say that sounds pretty like a rewarding job.
So I like, obviously I enjoy this population, working with seniors and their families. So that's, for me, that's probably primary. I love the people I work with. We have such a wonderful, diverse agency, resources that we can pick each other's brains to somebody knows something or knows somebody that knows something, that we can steer people to get what they need, if it's at all possible and available.
Yeah, I definitely love that about the environment here.
Yeah.
You can always go, okay, someone's got to know.
Yes.
Someone knows. Do you have a memorable experience or highlight that you've had?
Well, obviously I can't really share anything about the clinical clients,
Right.
because of confidentiality. I think while there's many things that stand out in my mind, I know that probably one of the highlights is working with some of the support groups. I work a lot with grandparents raising grandchildren, and some of them have because of our experience of coming to our support groups, have gained access to just either legal status, getting their legal status resolved, or resources to help them afford. Raising a kid this day and age is very expensive, and some of them haven't been able to navigate the system. So just even being able to put them in contact with the agency or the people that can help them navigate the system, and see them, come back and report that they have extra amount of money to help them raise their grandchildren, or they've resolved their legal status so they can get access to, even if it's, tax issues or the whole 9 yards of being really the parent of that child. That's probably been the thing that stands out at the moment.
Giving them a more secure home for their grandkids, I guess.
Yeah, and recognition, legally, to get resources to help them do such a, they're taking on a task that is out of love, and it's very difficult. They weren't planning to raise their grandchildren and children at this time. They want to be grandma and grandpa and spoil them and send them home, and that has not been their situation. They've stepped in some very, very hard situations, where adult children are maybe substance abusing or drug abuse or death or incarceration, and they have said yes, that they will not let their grandchildren be a part of the system. So that's probably one of the highlights, is working with that group.
So what should a first-time client of yours expect?
Well, like with every agency you go to, there's paperwork,
Okay.
Part of that, either whether if you come in or I come to you, because we do come to some of the seniors that aren't able to come into the agency.
Is that because their families come here, or how do you know to come to them? Do you just show up at people's houses?
No, I don't. I never show up uninvited. Usually, they either come to us for one or two ways. The senior themselves calls us because they've heard about us, either know about the agency through the community, or somebody has referred them. You need such and such. Why don't you call JFCS?
Okay.
And see what. Or KIPTA, because we're one of the focal points for this end of town. Often KIPTA and some of the other social service agencies will refer seniors to us so that we can help them navigate the system. So they call us and then come in, and there's just the kind of the basic demographic information that we have to get, and HIPAA releases and all the basic just paperwork. And if they're coming, usually what we do is in the first visit or visits, depending on the situation, is an assessment process. What do they need? What are they coming here? Kind of what resources do they have? What's kind of missing? Just really assessing, what's the situation and what's the best way that we can assist them. And so that's generally what happens during the initial visits, is kind of just the agency paperwork, or and then an assessment process. And then at that point, we develop, if it's not just a one-time event, they're just coming in just wanting some specific information and then go away, which is fine. We have a lot of clients that just are wanting something specific, and their need is met, and they move on.
Oh, okay.
Some clients are, have lots of needs or want something over time, such as counseling, and then we develop a kind of a plan of care if we're working with them. Or if they're, like, say, accessing some of our services, such as our PALS transportation program, we kind of follow them over time to make sure that they're getting the service that they want and that they're appropriate for the service. Or for our home care services, we go out and assess. We partner with some home health agencies, so we provide that continual presence to make sure they're getting what they need. And as life changes, if something changes in their health status or situation, that we can adjust things to make sure that the service is meeting their needs and iron out any wrinkles if there's any wrinkles down the road. Now, if I come to them, like sometimes a senior will or a family will call and say, I'm concerned about my mom or dad. So say, can you co-visit them? And we'll go out to assess them in their home if they're not able to come to us. And again, it's kind of that same paperwork of, we need to have the basic intake information, HIPAA forms, because whether they meet here or we come to us or we go to them, they still have their privacy rights. And then do an assessment, a psychosocial, which just kind of looks at the whole picture, what's going on, what are they asking for, and then set up a kind of a plan of care. What are their needs and who's the best to meet them, where to go, and kind of timelines.
Okay. And is there anything else you'd like to tell us today?
Well, I think it's important, to be a presence in the community. I think we really strive to do that. We're a really small team, so there's not many of us, but we really try to get out there and, are always willing to go meet with groups, do educational programs, any way we can help seniors or their families either learn something new, get access to something that they need, or just to bring a smile to their face. I think
you guys are everywhere, though.
We try to be, and that's a good thing. We don't wait just for folks to come to us. We really try to get out in the community, and that's how we get a lot of our referrals. Is you help a family and they have neighbors or loved ones, and they call, call Jo Ann, she helped me, and which is great. And that's always very rewarding when a family is satisfied with the service that we provided here, that they refer us to a loved one or a neighbor or someone that they care about. And
that helps make the scary situation less scary, though. If your neighbor or your family member is like, mm-hmm. I've been through this, you can go to this person.
Yes.
And you're not.
Mm-hmm.
Yeah.
Yeah.
So, okay, I think that wraps it up. So, thank you for being our interview today.
You're welcome.
And
thank you,
we will see you next week.